Are we ready to go, Jean?
We are ready to go. Ashley is your clerk for your meeting and Janine is the host of the Zoom. So
Hi, Chantel. Actually, we need
Okay.
a couple seconds
Okay,
before we go live.
let me know. It looks like it's live on my thing, but you just tell me when you're ready.
I think it's a two-step process.
Okay.
Okay, yeah, we're ready now. It'll show up live first and then it takes a couple seconds on my end, but it's ready now.
Okay, excellent. Thank you, Janine. All right, good morning. I'd like to call to order the Human Resource Appointment and Equity Committee meeting. Today is June 30th. Council Clerk, will you please call the roll?
Calling the roll, Ms. Brown,
Here.
Mr. Gallagher,
Here.
Mr. Jones. Mr. Jones is absent at the moment. Mr. Miller,
Here.
Ms. Conwell.
Present.
We have a quorum. Also like the record to reflect that council members Brady and Baker are also in attendance.
Thank you very much. Do we have any public comment?
Yes, there was public comment submitted. I sent it to the committee and that was submitted by Mr. John Corlett from the Center for Community Solutions.
All right, thank you very much. Hopefully everyone has those in their records. I'd like to make a motion to approve the minutes from our previous meeting. Is there a second?
This is Dale. I'll second.
All right, excellent. Thank you, Dale. It's been moved in second. If there are no questions, comments, or concerns, all in favor, will you please say aye? Aye.
Aye.
All right.
Sorry.
That's okay. All right. If there's no further discussion on the meeting minutes, they've been approved. Council Clerk, will you read the first item into the record?
Resolution number 2020-0122, declaring racism a public health crisis in Cuyahoga County.
All right. I know we have some individuals from the administration who would like to begin the discussion. So we'll start with the administration. Who will be speaking first?
I'll start. It's our
All right.
leaders.
Thank you, County
Madam
Executive.
Chair. Yeah, thank you. Good morning, everybody. This is an important moment in our county's history. This committee taking up urgent and vital legislation to declare structural racism as a public health crisis. I appreciate your commitment to this mission. I wanted to give a little background as the committee gets started. As we began to watch the COVID-19 crisis explode all over the world, Americans watched with horror as thousands upon thousands of our friends, neighbors, and family members got sick and died. The pandemic is still killing us, and it continues to expose deeply ingrained inequities in our systems. We're seeing this in the numbers. It's not just a feeling or anecdotal. Here in Cuyahoga County, Black people represent about 30% of our population, but represent 40% of the county's COVID-19 diagnoses, 45% of all the hospital admissions, and 45% of all the intensive care unit admissions related to COVID-19 in the county. And infant mortality gives us another example. With our active participation, we've been able to significantly reduce the overall rate of infant mortality in the county. But despite our best efforts to focus on the minority community, there remains a huge disparity between infant mortality for white moms and for Black moms. Controlling for wealth and for education, this disparity still remains. The most likely explanation is structural racism. Over the years, much of what we've accomplished together, has promoted equity. Our high-quality pre-K program serves 70% minority children. Our small business investments through ECDI and the Urban League, our demolition program, our elimination of a horrible garbage dump in East Cleveland, our support for CTAG and Say Yes to Cleveland, and many other of our programs promote equity. And during the COVID-19 crisis, we together have continued our efforts promoting equity. You approved support for a significant testing program focusing on people in minority areas. Our Connecting the Unconnected program focused on providing internet access to kids in Cleveland, again with a focus on minority families. Our Small Business Stabilization Fund that you generously supported, provided grants to 951 small businesses, and about 50% were minority owned. But as much as we've done, there's a lot more we need to do. Median household income for Black Ohioans is about 60% of that of all Ohioans, and almost 45% of Ohio's state prison population are Black. There's a lot more work that needs to be done. So several weeks ago, I asked our staff to work with the County Board of Health to develop an initial draft of this legislation declaring racism as a public health crisis. Once we had a draft we felt good about, we sent it over to Council, who had also been working separately on similar resolutions. I guess great minds think alike. Now together, we've arrived at what I believe to be a very solid and important piece of legislation. This legislation is both internal facing, looking at internal county government policies and procedures, and outward facing, looking at racism throughout all aspects of the community. One of the things that this legislation does is ask the Cuyahoga County Citizens Advisory Council on Equity and the County Equity Commission to conduct a thorough review of our county policies and programs to make sure that they're equitable and do not have unintended negative consequences, and to look as well at the conditions in our county overall and ways that we can better lift up our minority residents. The Advisory Council's report back to us is due December 31st, 2020. But I expect that we'll get thoughts and recommendations from them throughout the year. I look forward to working with them to help all of us make the needed changes within our own systems and throughout the county as we strive to eliminate racism. Thank you very much.
Thank you, County Executive Budish. I understand we have a couple of other individuals from the administration who will be giving us some background as well. I'd like to call to the camera or the meeting, Dr. Leon Harris. Is that who's next?
That's who's next.
All right.
Go down to the
diversion, okay.
Morning, Council.
Good morning.
Good morning, everyone. So I believe Trevor had the slides. Trevor, yes. Trevor, Trevor, can you load the slides for me, please? Thank you, sir.
Yeah, I can share the slides. Give me 1 second.
All right, thank you.
Just let them know who you are for the
Okay.
council record and stuff.
For the record, my name is Leon Harris. I am the Director of Performance Evaluation and Innovation for the Department of Health and Human Services.
Thank you very much.
Thank you, Trevor. So this morning, what I plan to do is walk you through a draft of the plan that was developed in the Department of Health and Human Services. And afterwards, if you have any questions, feel free to ask. I'm sure you will. And I'll try to answer to the best of my ability. So first, it should be pointed out, there are 4 different phases in this particular plan. And it should be pointed out that each phase can operate simultaneously if need be. So as I go through the plan, I don't want anyone to think that these phases have to happen sequentially or consecutively. They can operate concurrently. So first, starting off, setting the stage and increasing knowledge. So establishing a stakeholder ecosystem, and what that stakeholder ecosystem, what that term means is essentially what the executive just acknowledged around the Cuyahoga County Citizens Advisory Committee. So what you would like to do is engage employees. You also want to involve your clients. You want to make sure you have everyone at the table and consider everything so that you're not having those unintended negative consequences. So academics, you want to make sure you're having people from the public sector, excuse me, people from the private sector, and you're really bringing everyone together to make sure that you have a clear understanding of what's needed in the community before you make a decision of what the community needs. And then you want to also have a clear understanding of race, equity, and inclusion principles. And what that means is basically developing a common definition around what those things mean. And what common definitions do is that they help to create a narrative, and it's easier to communicate the commitment to racial equity both internally and externally. And so as I've done some of my research and seen what's going on around the country and in different areas, one of the examples of that would be in Milwaukee County. David Crowley, who's the executive there, and I think he was just sworn in this year. So I've already reached out to his office to see what struggles they've had, what successes they've had. Of course, I'm waiting on a call back. I'm sure he's pretty busy, but I have reached out so I can try to learn and understand some of the struggles and challenges that they've been through and what we should expect as we embark on this journey. So, but one of the things that Mr. Crowley did mention was establishing this stakeholder ecosystem and making sure that we have everyone at the table prior to making decisions. And he also pointed out that it's not going to be easy and that it's not a short-term solution. It's something that takes some time. So if you haven't seen, there was an interview that he conducted with Cleveland.com. So I think it's still on Cleveland.com. So that might be something worth looking at. Could we go to the next slide, please? Thank you. So phase one, continue, embed racial equity principles into the fabric of Cuyahoga County's organizational culture. And what that means is buy-in and practice from leadership. We really need that. That has to be, it has to be a top-down approach where that's demonstrated from the executive all the way through the other departments. We need to allocate resources. That includes funding, staff, time, and we need those to be solely dedicated to racial equity and inclusion. And that will demonstrate the importance of REI to Cuyahoga County. And consistently practicing REI ideologies to reinforce the position and commitment that Cuyahoga County leadership has to its workforce, residents, and stakeholders. REI should also be included in a part of the employee evaluation or reviews on an annual basis. So that's something else that we can do to embed these REI principles into the fabric of our culture. And then lastly, the commitment should not have a deadline. While we do have timelines of when we would like to meet certain benchmarks or metrics, there should not be a deadline to when we end our commitment to racial equity and inclusion. It should be something that stays within our charter or our policies so that we make sure we're allocating resources to it from here on out. Crucial conversation. So normalizing the conversation and making sure that racial disparities and inclusion discussions are happening and helping to improve and advance efforts throughout the county. So we want to make sure that these conversations are happening from the onset of employment. So making sure that they're included in training and orientation, that's something that we need to make sure going forward. Next slide, please. So phase two, getting to the root cause. So create subcommittees within departments or divisions to take a deeper dive into concerns or potential issues related to REI. Again, I think that's something that the administration has had on the books since 2012 as we look at the Equity Commission. So if we take this plan and we apply it to all walks or all departments, such as HR, such as fiscal, such as communications, and we look and review the policies and policies related to hiring and pay equity, contracting, service delivery, et cetera, our budgeting process, then those subgroups can then come back to the larger body and make recommendations around how to make changes that may be equitable or may have sustaining progress as we try to move forward. We also want to strategize the implementation of policy and practice changes and determine and understand the role we play in educating and informing our stakeholders of things like voting and census deadlines. There was a really good, I don't know what to call it, I guess it was a workshop or a session. Ms. Chantel Brown happened to be a part of it, but I watched it and it was a part of the census, and they were really able to educate our stakeholders and some of the citizens who were watching around what completing the census really meant to our communities and primarily the Black communities who can be missing out on so many dollars. So that's important as well. Next slide, please. Okay, phase three, making changes. So again, these phases can happen concurrently. I just want to make sure I continue to point that out. It's not something that needs to happen consecutively. But identifying strategies and target resources to address root cause inequities. So target programs resources, investments, and strategies to help enhance the equity and inclusion of Black staff, residents, clients, propose racial equitable solutions, and all of those need to be concrete and viable. So when we come up with these plans, we want to make sure that there are things that we can actually achieve. While we want to shoot for the stars, we want to make sure that these are changes that we can actually make as an administration and as departments as we move forward. Identify and develop assessment tools. So again, David Crowley from Wisconsin, Milwaukee County in Wisconsin, they identified a tool that I think it was called a budgeting equity tool, and I was really interested in understanding what that was. So that was another reason why I reached out and wanted to have a discussion just to see what he meant, how they developed it, how they applied it to their processes. So all of these things will happen with research and just reaching out and making sure that we're not trying to recreate the wheel, but that we're learning from different models that are going on around the country and people that have tried to improve their racial equity, some with success and some who have had some challenges along the way. We can learn from all of those things. Identify and develop assessment tools. So again, I have a few assessment tools, but it's really looking at how they apply to our population. Not all assessment tools are universal, so we need to make sure that we're looking at whether these assessment tools are appropriate for the demographic that we serve. Next slide, please. Okay, and operationalizing the use of the equity framework. So conducting race equity impact assessment for our policies and decision-making. The racial equity impact assessment is a vital tool for reducing, eliminating, and preventing racial discrimination and inequity. So we want to make sure that we look at something, again, that applies to our demographic and something that, that we can see the impact from. And lastly, continuing to evaluate effectiveness and adapt strategies. I think evaluation is an important part of any project or any initiative that we're doing. The evaluation should be, they should be there from the onset. Often we like to bring evaluation in the middle, and we really don't have an understanding of what type of data needs to be collected, whether data needs to be disaggregated, all of those things. So have an evaluation present from the beginning of the process, and then continuing to assess as we move forward to make sure we can look and see if any of the strategies that we've implemented, whether they're working, why they're not working, and how we need to adjust as we move forward to make sure that we reach the ultimate goal. And then the last slide, please. So this is a logic model that was created, and I should point out that this logic model is not exhaustive of everything that we need to do. And when I say everything, it's not exhaustive of the inputs, it's not exhaustive of the outputs or activities. It's really just a model and to give you a snapshot of some of the activities and things that need to be done, and really walk you through the things that we need from the onset. Again, the inputs to the things that we need to get to our long-term goal. Now, as we look at this logic model, what logic models or theories of change often allow us to do is it allows us, again, to assess over time to say, why didn't we meet the initial outcome, which was maybe to normalize crucial conversations around REI? Did we not meet them because we didn't have the REI trainers at input? Or did we not have the resources or dedicate enough funding or staff to the actual project? And if that's the case, we assess, we go back and we add those things to hopefully come up with a stronger outcome. It's also important to look at these outcomes and put a time frame on them. Usually when you're talking about the initial outcomes for something this large, we want to look at something from 6 months to maybe 18 months for the initial outcome. As we move to intermediate outcomes, we're looking at maybe 1 to 5 years, 1 to 3 years, and then the longer term outcomes, of course, where we have this REI implemented, or should I say rooted into our organizational fabric, that may take a little longer. But along the way, we're continuing to assess and making sure that we have the things that we need. So that's it from our presentation. If you have any questions or any additions, please let me know. Okay. And so I will say the HHS plan is an example of how to approach the problem. We will closely work with council and the advisory group to develop the county's overall approach. And I would like to thank a lot of the people that helped with this plan. Catherine Takacic is here, and also Sabrina Roberts, who has really been instrumental in helping me get my thoughts out and helping provide feedback and edits where necessary.
Thank you for that excellent and detailed presentation, Dr. Harris. One of the questions that I'd like to ask is that you talked about including racial equity or in the performance evaluation. Can you give us some examples of maybe the type of questions that we could use to add to our current evaluations?
I haven't thought that far, and that's a good question. That's a good question, but and I think it's more, again, working with HR to make sure that we're having that conversation, because I wouldn't want to be the person who's making these decisions unilaterally and saying that this is the questions we need. We need to make sure that we're understanding how any questions can affect or impact potential consequences. So I think it's something that should be discussed and then ultimately agreed upon by a larger group.
And before we go on, I just want to acknowledge that Council Members Jones, Tuma, and Stevens have joined our meeting, so thank you for joining us. I will open it up to my colleagues if you have any questions. I see Councilwoman Conwell waving her hand profusely, so we'll start with you, Councilwoman Conwell.
Good morning, everyone. This is for Mr. Harris. I have 3 questions, and it was based on the third slide that you just covered, the one previous to this. What will be your approach in selecting the departments? Can you hear me?
Yes, I can hear you. I'm just looking at the slides. I'm sorry.
What will be your approach in selecting the departments you will start with?
You said selecting the departments that I would start with for?
In terms of overall, because the county is large.
And so in my opinion, I don't think I have the ultimate decision-making power on what departments we approach. But in my opinion, as we move forward with racial equity initiative, I think to create buy-in and trust amongst our stakeholders, staff, and clients, I think it's important to understand what things we can potentially change fast so that they recognize our commitment to racial inequality and inclusion. So whether that's reviewing policies or programs that we have and making these changes in a swift manner so that we can give them something and show them that, look, we are committed and dedicated to this, and then prioritize along the way and say, this might take a little longer, so we're not putting it off per se, but we're really strategizing and planning of the best approach to address it.
Are they putting you in charge of creating that framework?
For Health and Human Services, yes. As far as county administration, I'm not sure about that.
Okay. Second question, how long will the research occur? You talked about researching this process along the way. Give me a guesstimate of how long you think the research will take.
I think research is an ongoing process. I think as you look and you assess, I think through an initial, search, you don't find everything. I think you continue to learn about different projects are out there, different models that are out there. And of course, as we've seen, multiple counties have come forward and declared racism as a public health crisis. So as that happens, you want to see what your peers are doing in other counties or in other states. So as we see this continuously happen, we'll probably continue to reach out to our peers and ask how they're addressing it. And I think it's fair to want to find a comparison group or a county with demographics that are very similar to yours to try to compare it and see if what they're doing is applicable to some of your workforce as well as the residents that you serve.
And who will evaluate the effectiveness and adapt the strategies?
So I have evaluation experience, but ethically, I don't think that it's something that we should do internally, especially if this is something that we're funding. And I think it comes better if we have an independent evaluator with an independent response or assessment. But right now, I have no idea who will be evaluating it. I think that's a recommendation, and it's something that we will continue to address and look at as we prepare the plan.
Thank you. Thank you. Thank you, Madam Chair.
You're welcome. Councilman Miller, I see you. You're next.
Yes. Thank you very much. And I strongly support this effort. It's very much needed. The the reach of racial inequity is just so broad. It affects almost everything that we do in Cuyahoga County, and so the question I would like to ask is to the county executive or whoever else can answer it as to whether the approach we're going to take in Cuyahoga County, are we going to have a county-wide system that's going to be done similarly throughout all departments, or is it going to be more decentralized with each department developing its own plan?
Yeah, so I think that's to be determined. I think as we continue to assess and look at our work, again, the plan that I shared with you is a Health and Human Services plan. However, it's been drafted so it can be adopted or applied to other departments or divisions within the county overall. But that's to be determined by different chiefs and areas that they oversee. So right now, I think there's no concrete answer, but I would say to be determined.
Okay, thanks.
Thank you, Councilman Miller. I am going to go to Councilman Tuma. I know we have another engagement, so Councilman Tuma, the floor is yours.
Oh, thank you very much, and I appreciate you letting me speak, even though I'm not on the committee here. Mr. Harris, appreciate the slide that you presented to us. I know there's a lot of work that went into that, and I'd also like to commend the administration for being proactive on this important issue. And in addition, I'd like to commend Councilwoman Brown, who was on top of this issue before it became a hot button issue in the country a few weeks back. Had some legislation that she was working on before everyone else kind of jumped on this issue. So again, I want that to be known. Mr. Harris, specifically, I think it's essential, we're talking about what departments to get involved and what stuff. I think it's essential to involve our hospitals, as this is a health crisis. I think it's also essential to involve our courts and our police, because we're talking about trying to take care of a systematic problem. And I think some of the major issues that we have with race in this country stem from a history of African Americans and other minorities not getting fair treatment in their health care, racial profiling, treatment of blacks by officers. And again, we're not painting a broad brush on every police department that's out there. But again, I think this is a good starting point to be very proactive and to you talk about stakeholders. I think making these groups, these departments, a part of the discussion is essential moving forward. So I would ask that the administration be very cognizant of that fact. And again, I appreciate everybody's efforts on this very tough and intricate problem.
Thank you, Councilman Tuma, and thank you for those kind words. It looks like Councilman Jones has, Councilman Jones, do you have a question?
I do, Madam Chair. Thank you. All right. Good morning, Mr. Harris.
Good morning,
Can
sir.
you hear me? Good morning.
Yes.
All right. My question is around, well, as we know, racism impacts every aspect of our county government and society. Are you stating that your role will be in the health and human service world, the healthcare world, child welfare? Is that your wheelhouse, or do you cover all aspects of the legislation?
So Health and Human Services consists of Division of Children and Family Services, Job and Family Services, Senior and Adult Services, as well as child support and the community initiatives, Invest in Children, Homeless Services, Reentry, and I think I missed one there, FCFC. So all of those fall up under Health and Human Services. So we'll be looking and working with the directors of those areas, as well as any identified representatives, to see what changes we could potentially make in Health and Human Services to address racial inequities and diversity and inclusion. We started this back in February of this year with Division of Children and Family Services. I actually have a certificate in diversity and inclusion from Cornell University. And so I started a training and a workshop with Cindy Wisekettle and her leadership staff, where it was a 3-hour workshop that was received very well. And I'm actually doing another one with the leadership staff of Job and Family Services tomorrow afternoon. So it's something that we've started, but and we wanted to continue. Then COVID happened, and you know, we've kind of been in this situation, and we're trying to really understand the best way to deliver this material. Because as you know, having discussions around diversity and inclusion via Zoom or Teams, you can often lose context or tone in some of the information that you're trying to deliver. So that can be difficult.
Okay. You know, our county executive made a powerful statement once, and I'm going to repeat it, but paraphrase it to some degree. He said, we have a health and human services safety net, and we catch those that fall. He said, but we need to spend more energy and time focusing on making sure people don't fall to begin with. And the safety net is the area that you dwell in, human services, healthcare environment, that safety net to tear people from not falling to begin with, are the education, they are the criminal justice reform, the housing, the opportunity for businesses and contracts. Those areas, again, help people to stand so that they don't fall. Has someone been identified to cover those areas of the legislation that you that are not in your domain?
And I believe that's the Equity Commission, as again, that's been on the books since 2012.
And maybe this question.
Hello?
It has. Can you hear me? Hopefully my connection is good. Can you hear me?
Yeah, I can hear you now, sir. Did you hear my response?
I did not.
Okay, so as I was saying, the Equity Commission, that has been a resolution that was drafted in 2012. That's something I think in different areas of the administration where they will look at those areas that you named. And also, again, as I stated earlier, this is just an example of a plan and how to approach the problem. We'll continue to work with council as well as the administration to develop the overall county approach.
Okay. My hope is that what we don't want to happen is for those in these positions to be marginalized. Councilman Miller said, I think spoke accurately when he mentioned a concern around decentralizing. We want to make sure that every aspect, every area, whether contracting, whatever area in the county government may be, that we have an effective mechanism in place. So if it's not totally fleshed out yet, I can understand that. But we certainly want to get to a point where whatever area in county government we want to discuss, there's someone, a point person, you know, or some mechanism, process in place that we clearly know how we can learn what the problem is and what suggestions or strategies for addressing the problem should be. So that needs to be clear.
And that's definitely noted. Thank you.
Okay.
All right, we also have Councilwoman Stevens, but before I proceed and turn the floor over to Councilwoman Stevens, I do want to remind the members that we do have 2 more presentations from Terry Allen and Ramona Brazil. So some of the things that we're tossing Dr. Harris's way might be covered in another aspect. And I also want to touch on Scott Tuma's comment relative to health. I had the privilege of being on a call with Dr. McKenzie of South Point Hospital. So we are aware that our institutions are taking this matter equally as serious as we are. And I'm confident that we will be able to weave them into the fabric. So with that being said, I'm going to turn it over to Councilwoman Stevens. And then after that, I'm going to ask Terry Allen and Ramona Brazil to to get ready to step up so we can hear your presentation. Councilwoman Stevens, you have the floor.
Thank you. My comments dovetail with my colleagues Purnell Jones. I really would like to strongly encourage the county executives team to begin to bring in collaborations with the private sector. It is incredibly important that we work with, for example, the Greater Cleveland Partnership, to get them as one of the largest chambers of commerce, to get their members who are often very affluent and large employers to begin to create dynamics internal to their organization, because success with the ending of racism affecting every piece of our life will begin when we are financially strong. That is the best end to racism, financial strength, so that we are no longer falling in between the cracks or falling into the need of all of the social service safety nets. So thank you, Madam Chair.
You're more than welcome. Thank you very much.
I think that goes back to the point around the stakeholder ecosystem that I mentioned in the first slide, where I discussed creating an environment where we have everyone at the table, and that includes public sector, private sector, as well as foundations, philanthropists, and financiers. So I agree with you 100%.
And I have a personal saying when it comes to presentations, particularly with our council members, is that the first gets it the worst. So, so Dr. Leon, thanks for stepping up and fielding a lot of questions, probably that you may not have anticipated. And again, some that may actually be addressed by your successors as they present their PowerPoint. So I'm going to turn it over to them now. And if you have to, I think you expressed that you have another commitment. So council members, committee members, if you have any additional questions for Dr. Harris, I would respectfully request that you write them down or send them via email, and our staff will make sure that they get to him. Thank you, Dr. Harris, for your presentation. Mr. Allen, you're up next.
Thank you for having me. Trevor, thank you for getting my slides together.
Thank you, Madam Chair. My sound coming through okay?
You are good.
Good. I wanted to just introduce myself. I'm Terry Allen. I'm the Health Commissioner for the Cuyahoga County Board of Health, and I'm joined by
Brazil, Co-Director of Prevention and Wellness.
So I'm proud to be joined here by Ramona to walk through a few slides for you. We'll move quickly in the interest of time. I would say that the Board of Health has been working at issues around health and health equity for a decade. And it has been a learning process for all of us internally, externally, as we begin to think about and have been thinking about how our work, how equity and race affect our work, and how we can be most effective to serve our community, the diversity of our community. And so I want to build on the comments from Executive Budish and from Dr. Harris going forward in the work we'll be presenting. And Ramona and I will collaborate on these slides. And so we'll move through, and we appreciate the opportunity to be here today to express our full support for this resolution.
So I thought that this quote was a good way to kind of start the conversation. We understand that this is a very difficult conversation for a lot of people, and it really goes to the core of who they are and what they believe. And we can't ignore that in talking about racism. And so I thought this quote from James Baldwin is a good one, is that, you know, we cannot change this until we face this. And to me, this is a very important day in our community where we are very boldly and loudly saying that racism is a public health crisis in our community. And by doing that, we're saying that it's important enough that we need to put a lot of resources and energy to face it, because we want to improve the health of people who live here, and everyone, and Black people especially, because we know about the impact of racism on health. And you all have already talked about it pretty extensively, but also for those who may be watching live on YouTube, we do want to call out the difference between equality and equity. And we're talking about focusing on equity. And that is mean that everyone has what they need, and have their opportunity to achieve their full health potential, and that is not disadvantaged by things such as race, ethnicity, gender, religion, or disability. So this picture is often shared to illustrate that, but essentially we want everyone to have what they need to be able to participate. And when we talk specifically about inequities, we are talking about a system that is unfairly advantages some people and disadvantages other people. And these are often called the isms, and you can kind of insert the isms into the blank. Racism, when we talk about gender, we talk about labor or class, poverty status, all of those things can create inequities in our society. So today we are specifically calling out racism, and I think it's important that we distinguish intentionally between race and racism. So according to Garcia and Sheriff, race is a social construct with no biological basis, whereas racism refers to a social system that reinforces racial group inequity. So also Kendi describes racism as a powerful system that creates false hierarchies of human value. So being Black in America has negative implications for education and professional trajectories, socioeconomic status, and access to healthcare services, and also resources that help promote optimal health. So they argue that the consequences of health, I'm sorry.
Ms. Brazil, I'm just going to ask you to pause for just a second. If you could speak a little bit louder, and if you aren't speaking, I'm just going to respectfully request that you mute, because we're getting a little bit of background noise. So if you wouldn't mind, thank you very much.
Does that make it better?
That's much better. Yes.
Okay. So what we're arguing is that health disparities are a consequence of racism and not race itself. So sometimes the question is often about the differences in health outcomes among groups, and what we're specifically calling out is racism. So to us, it's time. We have to get comfortable with uncomfortable conversations, and I think the last presentation talked about that, about race. And instead of being colorblind, we need to be color brave. A lot of times people will say, about being colorblind. Me personally, when someone says they're colorblind, in a way that kind of denies part of my existence. And I don't need someone to deny part of my existence to be treated fairly. So, that's also denying a part of someone's experience. So we understand that this is uncomfortable, and we are asking people to put themselves in an uncomfortable space to try and reach this goal. So we often talk about the social determinants of health as root causes of health issues, and it really plays out in the conditions in which people grow, play, live, and work, and they are created by a larger force of economics, social policies, and politics. That's generally a pretty common discussion of that. But what we also want to count out is that what we see are the negative health outcomes, and we often put a lot of resources towards those things, as Councilman Jones was pointing out. But we don't often get to the root causes, which is shown on the left, such as environmental toxins. When we talk about institutional racism, we talk about adverse living conditions. If that is what people are coming out of, that is in the root, then you would expect higher rates of those negative health outcomes that we see. So racism, and this is from American Public Health Association, is a driving force of the social determinants of health. And so for Black people in America, that does include housing, education, employment, and those things are a barrier to health equity. So to really achieve health equity, we do have to address the injustices caused by racism.
Thank you, Ramona. We may be going back and forth through the presentation, Madam Chair, so please bear with us. So we've been fortunate to be part of a consortium in the community called HIP CUYAHOGA, the Health Improvement Partnership CUYAHOGA, that was convened some 7 or 8 years ago around developing a health improvement plan for the community. And so it's a large consortium of a range of agencies from different sectors. It is coordinated by the Center for Health Affairs, which is the Hospital Association now, and of course, work happening with the health departments and a whole range of sectors, academia, social services, nonprofits, government. And so the co-chairs of the HIP Cuyahoga initiative have been Dr. Heidi Gullett, who's a medical director here also at Case Western and Neighborhood Family Practice, and Greg Brown from Policy Bridge. And I want to thank some of the work historically done by Martha Halko and Michelle Shaw at our department in supporting the fantastic group of folks that have worked in this consortium for so long. And we've been focused lately around developing a health improvement process, a renewal of the health improvement plan for the community for the next iteration, and completed a 2019 community health assessment that helps to provide context for our discussion here. So what we learn in the process through HIP Cuyahoga in our work in the health improvement planning process is that limited opportunities and poor health equal shorter lives. And so we begin to think about ultimately what are the upstream consequences of what are the upstream things we can do that can impact the downstream result in shorter lives and unequal opportunity. And many of them are in the box in the blue on the left. And we'll talk more about these because underneath each box, you'll see social factors and conditions that shape health behaviors, mental health, and health outcomes and mortality. They are centered under those boxes because they are sort of broken out into whether they are upstream things that we need to change over time to have an impact on the downstream result. Mortality is not a coincidence around infant mortality, life expectancy, and ultimately disease-related mortality and the disparities that exist in the African-American community. They are related to things that are happening upstream that perpetuate those inequities. So if we look at that 2019 community health assessment, and this was done in coordination with the hospital systems. It was done in 2018 and 2019 in order to align the hospital's IRS requirements, nonprofit hospitals assessment requirement, and health departments. So it was a rather heavy lift working together with the Cleveland Department of Public Health, the Cuyahoga County Board of Health, the hospital systems, and our community partners that included social service agencies and community members, community health workers that were part of the voting process, were part of the decision process, were provided key information for the work and providing context. So there were two major overarching themes that followed from our health improvement plan some 7 years ago that were now restated clearly in support from the hospital systems and from the health departments and community partners around eliminating structural racism and enhancing trust and trustworthiness. And that is between hospitals, government systems, providers and patients, social service agencies, and the folks they hope to serve in the community. And the message is really about inclusion for us. What are we doing to include people up front? I've heard members of the community tell me, nothing about me without me. And for us, I think that's an important context. So we have these components underneath that we've talked about, these community conditions, mental health and substance abuse, and then a range of chronic illnesses that we'll talk about in a moment.
So this goes back to the point of we really do need to move upstream. This is a quote from Desmond Tutu, that we need to stop just pulling people out of the river. We have to figure out why are they falling in. And that does go back to the discussion about the safety net system, which is important and that we need to support. We need to continue to support it. But we also have to figure out how do we create a community and a society that thrives. And in many ways, some of our goals, when you read them, are about surviving. And so how do we go from surviving to really thriving in our communities? That really should be our goal for everyone who lives in Cuyahoga County. And so this is a model that we've used for many years to discuss health equity. And what you see on the right side is essentially the medical model. That's more the downstream approach where we focus on individual behavior, risk factors, and also we're trying to stop the ultimate outcome from coming. And what we're saying is that we need to move upstream on that social ecological model. And right now, by starting to talk about this in this way and putting this as important for Cuyahoga County, we're talking about all the way at the top where we're talking about discriminatory beliefs. And honestly, if you would have told me we would be in this place 10 years ago when we first started looking at this, I would have thought no. I felt like we were really fighting against it and we were doing the best that we can. So, we need to support across the spectrum because we have to support people and their ability to be healthy. And so that begins right at the beginning with discriminatory beliefs. And it also ends with what are the factors that cause people to either be sick or die early and really prevent those across the entire spectrum. I'm like using two mouths. Let's see. This is the right one.
Thank you. And so this is a map that is familiar to many. It is a decades-old map of, it's called a redlining map. We know that many have seen this in our county, and this is a legacy not just locally, but in many communities across the country and really based on national policy. The areas in blue and green were considered areas that were favorable for loans that were lower rate loans and by the system. And essentially the areas in red were considered areas that were not as favorable for providing loans and were higher risk. And these maps were developed based on federal policy directly related to race and ethnicity. And so I would submit to you that the work we've done in HIP Cuyahoga, it's important to understand the history as we move forward into the future, because this history, this map has really created the context for what we're living with now in terms of the poor health and the disparities in the community that disproportionately affect the Black community in greater Cleveland. And so that is a theme that we'll see and demonstrate here in our discussion. And we'll keep moving quickly, Madam Chair, but we think this is an important component.
So, a lot of people see the redlining maps, but they haven't seen the document that goes along with the redlining map. So, each community, as Terry explained, was assessed, and a kind of a really brief report was then written about that area, and that is what was helped to use to build the redlining map. So the redlining map is, for certain, an example of a racist policy. And it's one that produces and sustains racial inequity between racial groups. And so you can see words such as infiltration, which has a negative connotation for sure. And so these were produced for every community in Cuyahoga County. So this document is actually in the National Archives. And I was able to assess all of them through the Ohio State University Kirwan Institute. So in this one, it describes this potential influx, and it talks about how this is the least desirable neighborhood, and that it's abutting next to a Negro settlement. And it also talks about kind of that infrastructure that we talk about that supports communities and being healthy. So there's no transportation, there's no sewers, there's unpaved streets, and it's taking its toll. And at the bottom, it talks about there's no further development is anticipated for white ownership. This is being, this is explicitly being used to rate these communities. And then it's also going to then be used, as Terry mentioned, to decide where loans can be given for home ownership for businesses. And of course, it was used beyond that. I mean, that's just what its official use was. And redlining, which, these studies are from the 30s and the 40s, was not outlawed until the 70s. So this has a profound impact on what Cuyahoga County looks like. And sometimes we think that it's happenstance. It's not happenstance. This was very intentional. And here's another one from another area. And so in this particular community, there was a concerted effort to move Black families out. So you know, in thinking about what that would mean for that family member, that family to be pushed out of an area because they were not desired in that community. You know, this also led to racial covenants where people would not be sold houses and contracts they couldn't sell to a person. All of this has shaped what Cuyahoga County looks like today. And so that's part of why, you know, when intentional things are done, such as a racist policy, as redlining, then intentional anti-racist policies also have to be done to correct it.
And so I think I would just say, as Ramona's pulling up the slides here, I think there's one more click, is that I would say that what draws people to this work we found is both a head and a heart approach. You can use the head in terms of looking at the data to demonstrate what are the facts on where we stand. The heart is understanding that you may be driven by your desire to support Greater Cleveland. And this is a national issue, to be sure. But what can we do here locally in our community with the people that we live with, the people that we want to thrive with? And it also may be a component of what you believe from a faith perspective. It can be a variety of ways to bring people together and what draws you in the heart in this discussion. What you see on the maps now is the bottom left, you'll see the redlining map. And then you look at Cleveland's, the Greater Cleveland County poverty map and the concentration of poverty. Then you look at where, in this case, the Hispanic community on the near west side in the top green map, and the African American population, higher numbers of African American folks living on the east side of the Cuyahoga County. These data mirror redlining maps that Ramona described going back some 70 or more years ago. And it set the course for decisions on where people lived, and it created unequal opportunities for health and wealth. We say now that looking at these maps, unfortunately, that your zip code may be more powerful than your genetic code. You can see those areas then highlighted there.
And, you know, part of what this ultimately does lead to, which we talked about when we're discussing HIP Cuyahoga, is shorter lives and sicker lives. And so this is an older map at this point, but, you know, we can look at what life expectancy is across our communities, and we can see very significant differences in life expectancies in very short distances away. And again, it mirrors what we see from historical practices with like redlining. So there's an old adage, I didn't make this up, but it's when white people get a cold, black people get the flu. This particular adage really talks about the severity of illness that then impacts the Black community in comparison to white people. And, you know, it really shouldn't be a surprise to anyone who's worked in equity work for a while that we would see a disproportionate impact of COVID-19 on Black communities. What I think we should say is that it's not acceptable. And I think we are saying it's not acceptable, and that we're committed to doing something about it. In the middle of a pandemic, we're not gonna fully address inequities that go back 400 years, but we do need to make sure that, you know, we align our resources to help people, and that we focus on addressing these health disparities that we're dealing with now. So this is the latest of our COVID-19 mapping. And so you can see, now we feel like, so COVID is everywhere. You know, people's risk is still high. We have seen an upswing in cases in the last week, which we've talked about. We've also seen an upswing in the number of young people who have COVID at this time. But we're also starting to see a kind of a familiar pattern emerge again in our maps. And so this again is where we're saying that this is unacceptable. And as was previously described, we're also seeing higher rates, a disproportionate number of African Americans or Black people who are diagnosed with COVID, and we're also seeing a disproportionate rate of those who are hospitalized or admitted into ICU. But when we talk about kind of those social determinants of health, what are the underlying factors? Because again, we're not talking about race, we're talking about racism. We're talking about less access to sick time, less ability to work remotely, a higher percentage of essential jobs, so people who can't stay home, who have to go work face-to-face, less access to healthcare. So all of those things are what is contributing and driving the disproportionate impact in the Black community.
So this slide shows it's from the Health Policy Institute of Ohio and really helped to shape our sense of equity and how we think about equity in the community. And it reads that everyone is able to achieve their full potential. This requires addressing historical and contemporary injustices and removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments and healthcare. And for me, this is really about, as a community, how we move forward. And when we all do better, we all do better as a greater Cleveland, as a county. And so this is zooming in now back to our health priorities. You'll see under those domains, specifically under quality of life, what rose in terms of the data and hearing from our community and social service agencies, poverty and food insecurity, transportation as quality of life barriers, heart disease, asthma, diabetes, certainly longstanding challenges around chronic diseases, flu vaccination rates. Now, certainly going forward, it will be COVID vaccination rates, tobacco use, lack of physical activity are within those health behaviors and creating opportunity there. And then mental health and addiction. I know we've been partners with the Alcohol, Drug Addiction and Mental Health Services Board for some time, certainly around the opioid response. Seeing also disproportionate numbers of fatalities with the use of cocaine and opioid mixes and fatalities. And on the maternal and child health, again, infant mortality, we're quite familiar with, as well as childhood lead poisoning. So this is a slide just to state and feedback we got from our community stakeholders. As Dr. Harris mentioned, you have a citizens advisory committee that's been in place. We found that to be a critical pathway in our health assessment process, gaining insight on what people are hearing in their communities, in their neighborhoods, not just community agencies that represent the community, but actual folks living and facing the challenges and wanting to be part of the design of what the solutions may be. And so they provided input. We encourage folks to continue to engage and do it in ways that are more easily accessible for residents in their neighborhoods at times that they're available and in ways that they'd like to engage. We think that's critical.
So when we were reflecting on what does, declaring racism as a public health crisis mean? I think first it acknowledges that racism, historical and current impact on the health of Black people. It also does require a commitment to self-awareness and reflection. Like Terry spoke, we have worked with Natalie Burke from Common Health Action through a lot of our agencies' work in this area. And she does describe it as both heart and mind work, that people do need to reflect on what they may be bringing into a room or a discussion, or when you're making a decision, how have your own personal experiences, thoughts, or beliefs shaped how now this policy will go on to affect many different other people. Also, accepting that these conversations are uncomfortable, they're deep and they're meaningful, they need to be intentional. And, we have to get comfortable with being uncomfortable. I think probably, I've worked here about 18 years and I've had more real conversations with people about race and racism in the last few weeks than probably in all those years beforehand. But I appreciate when people are trying to give of themselves and understand a different perspective than maybe they had considered before. Also, people have to make a determination. So Kendi also posits that the opposite of racist is not racist. That's not what it is. A lot of people will say, well, I'm not racist. So someone who says they're not racist is signifying neutrality. And he says that the opposite of racist is anti-racist. And so that's a person who is committed to locating the roots of problems in power and policies, and that no policy is race neutral. So every policy in every institution in every community is either producing or sustaining inequities, or is producing and sustaining equity between groups. So it's so when we talk about the county's approach on looking at how policies affect people, then that is an intentional way of ensuring that it's promoting equity and sustaining equity. By ignoring it, we're actually sustaining inequities. And so, you know, that strategic action that aligns our values with our resources and committing to elevate the value of humanity. So a lot of times when we have our conversations about health outcomes, you know, it can feel like blame, or it can feel like lack of empathy. And instead of looking for why it's okay that a group of people are in a certain human condition, I feel like we should focus more on how are we going to support our community in being healthy and ensuring that they have the things that we need to thrive. And so that does end with committing to invest in what creates health for everyone. And we know that those things include safe neighborhoods and education, and good jobs. And those types of things are what sets people up to have optimal health.
So as we're wrapping up on our final content slide, the Board of Health fully supports and is proud to support the resolution to declare racism as a public health crisis in Cuyahoga County. That the action items proposed in your resolution are very consistent and supported by the data that we find in the 2019 Community Health Assessment. We know that we believe that establishing an equity commission, and certainly in collaboration with the Citizen Advisory Committee, is an important component for an accountability and inclusion in the process going forward. And a fair opportunity for good health promotes economic prosperity for our community. The COVID examples we see now that Ramona described, and we hear on countless discussions with cases of COVID as we talk about their situations and challenges that they face in order to make ends meet. Multiple jobs, often lower paying jobs, without health insurance, frontline workers that are disproportionately exposed, are more tears in a salty sea of what have been inequities and disparities for many years. And so we thank you for your leadership in taking on this very important resolution. It is an incredible moment in the community, as busy as we are, and I don't know that we could be busier in our response, and Ramona in an incredible leadership role in our response. We're proud to be here to support this resolution. Thank you very much for the opportunity to participate and to present.
Thank you for the very thorough presentation. I think you make a very strong case for why it is so important to declare racism as a public health crisis. So I'm going to open it up to my colleagues on the committee. If you have any questions, now's the time.
Dan Baker, may I ask a question?
Councilwoman Baker.
Thank you. Certainly have appreciated all the conversation today, and thank you for all the work that's being done out there. I have a couple of questions that I'm waiting to ask, and one is, you know, I agree with Executive Budish in his overview, and especially his comment on a thorough review of our existing policies, because I think that, you know, for the time that I've been here, we do have a great deal of programs in place, and to analyze what it is that we're already doing, I think a great way to at least begin the process or understanding of what it is that we are already investing in. And then secondly, for the resolution in section 3, I appreciate the data measurement strategy for determining and publicly reporting the outcomes, measuring success, understanding, you know, where we are and where we want to be. And I think that is just as important as understanding where we're at. So those are the two pieces of the legislation that I'm really appreciative are part of it. I did want to say, though, that I hope, and I haven't heard, but maybe it's just assumed, that our Director Merriman, who is in the trenches with his social workers, becomes part of this conversation. I think that, we have seen the turnover of social workers, sometimes the overwhelming tasks that they're asked to help those in need and perhaps don't have the resources. That would be a good resource, I think, to also have Director Merriman involved and also have the input of the social workers who are there in the front lines trying to help those that are in most need. So those were the comments I wanted to make, and I appreciate the resolution and all the conversation and work that's been set forth so far. Thank you.
Thank you, Councilwoman Baker. I would like to address your question with regards to Director Merriman. Dr. Leon Harris is second in command under Director Merriman right now, so he's very much involved and has charged Dr. Leon with the task. So during his confirmation hearing, that was one of the issues that Director Merriman touched on. So I appreciate the administration's thoughtfulness and involving HHS. And I think I would have to agree with your point. This is something that has to be worked on throughout the county, and the social workers are a very critical part of this, will be a very critical part of this racism as a public health crisis moving forward. So were there any other questions or comments? Would you
Yes,
have
Madam Chair.
Councilwoman Baker? Okay, she's muted. Okay, Councilman Jones.
Yes, thank you, Chantel. Well, first I'd like to thank Terry Allen and his team for that thorough presentation and just for the work you've been doing over these few months. It's been critical, and you've done an excellent job, and as well as in this presentation. But I did have one little bone to pick in the initial slide. And I don't know if you're able to bring it back up, but it was the illustration of the three individuals being able to peer over the fence. Is that something we could pull back up to see?
Yes, I'll pull it back up.
Okay.
Don't get too dizzy on me.
Okay.
Sometimes it's almost there. There we go.
That's it. I have one little bone to pick with this. I think it actually says the opposite of what we want. Here's what I'm seeing here. The three individuals that are standing on boxes, given the opportunity to see over the fence. It says that they are inherently unequal by birth. Some are just too short, and we need to help the shorter people to be able to see over the fence. So I would take them to be obviously maybe white, Hispanic, African American, all the racial groups. I said, but that's not the reality. The reality is that everyone is the same. Everybody's equal. Everybody's the same height. What's unequal is not the person. What's unequal is the floor, the ground on which they operate on. There is a seesaw, so to speak, where all of the same height, but the tallest person in the picture is standing, in this one, they're standing on the top of the seesaw so they can see over, but others are lowered and they're not able to see over. So what needs to be leveled is the floor and not the people. I don't know if that sounded too convoluted, but the imagery, I would not use that imagery again. I would use one where the first box of equality has where the people are all the same height, but they're standing on a sloped hill, so to speak, or on a sloped platform or board. And where the boards need to be placed are under the floor for all people with the same height, so that all have opportunity to see over the fence.
I agree with that. I agree with that point. There's actually that particular graphic has been is actually debated on online. So there's actually been whole, conversations about why even that particular point isn't an accurate depiction of it. So I do like the thought of understanding that it is the uneven ground itself.
But I'm going to jump in because one of the things that I think that my colleague, as well as you, Ms. Brazil, are saying the same thing in a different way. And we have a slide to illustrate that point. And I'm going to ask Trevor to pull it up. It's the fence.
Right.
The third image, all three can see the game without any supports or accommodation because the inequity was addressed. As members of this council and as well as the administration, we have the power and authority to remove the barriers and give everyone access to view what is the game of life in this situation. So, because the reality is, spiritually, which I know my brother Pernell Jones, and we connect on that level sometimes, is that God created us all equal in his eyes. And I don't want to get too deep on that. So yes, there is as humans, we are equal, but we are born different. And so we should not ignore the differences. But what we should do, and what I hope to do, is to eliminate those barriers that makes our difference, that impedes us from seeing the whole landscape and opportunities that are available to us. And that is the goal that I would like to achieve. So I hope that this image, the third image, is a unifying image that both Ms. Brazil and Councilman Jones and I can equally agree on as the as what we hope to do in places where equity may not be enough. If you in reality, we can remove barriers. And we can remove barriers. I think that is what we need to do, and we have the power to do it. So I just wanted to point that out. So I'll thank you very much. I will open it back up to my colleagues if you guys have any other questions.
And Madam Chair, if I could just follow up.
Yes, please.
Yeah, again, the imagery is all three are the same height. All are equal. You have to create a visual where you don't actually say the exact opposite. That visual tells us that there's a fundamental inequality in the people themselves. Some are capable, some are not. And that is what needs to be eliminated from that imagery. And I'll do this. I'll quickly just give you two examples. Historically, if we go back when I was a child, I loved watching football. Back in the early 80s, there was one position an African American could not play, and that was the quarterback position. And the rationale was that, and it was literally said on TV, very delicately, professionally, but it was always said that maybe they don't have the leadership abilities or the intellect to play that quarterback position. Well, that did change in the coming years. In the 80s, we had Randall Cunningham for the Philadelphia Eagles. Doug Williams became an African-American quarterback who won the Super Bowl. The floodgates opened after that point. There was never inequality. All it really did was protect the privilege, the position, fame, and income that came with that position as quarterback. That was all. And the idea of there was an inherent inequality was just a matrix, just a dream, made up story to cover the reality and again, protect the power and fame that position brought. The playing field was unlevel. Once the playing field was level, today it's a non-issue for us. None of us struggle with quarterbacks being African-American or white. We've got all great quarterbacks of all races. It's a non-issue today once we address it. But to imply, infer, consciously or unconsciously, that we're not just all the same. We're all equal. No one is better than anyone else. If we just let that myth go and not let it be a whisper that covers the inequality that's going on, then it'll be just like football today. Everybody can play, and it's a non-issue. Okay, so I'll leave it at that.
All right, thank you very much. I'll continue to open up the floor if there are any additional questions, comments, or Councilwoman Conwell, I see.
You see, I'm getting ready, right? I just wanted to say kudos to you for pushing this. Equity has been my passion since I started. But what I want to say is over my tenure, the administration really needs to make this a priority mission and stay on it. And the reason that I say that is because previous measures have been to work on a hot button topic. Then as other crises or hot button topics have made a main stage, other things are put to the back burner, so to speak, or become less of a focus. And I've watched this continuously happen over my years on council. So with this legislation, if we're really going to push it, and I'm all about the action that we put behind it, if we're really going to push this legislation and vote on it, it says that Cuyahoga County has been working on equity and how to achieve equity. Then we need to dedicate, administration needs to dedicate their staff that when that next hot button topic, which will probably be COVID again or some virus in the fall, that we're still continuously working on this. And I know that we have made small strides in HHS, very small strides. You know, when I think of someone being racist, and I think we all are in some little way towards something, maybe not towards the color of a skin, but individuals need to, as an administration, we need to look at the individuals that are in supervisor positions or just our employees to begin with, because that's where I believe that racism stems from. It's from our mentalities, how we work together, how we think about one another. And I recently had a text last night. So something is going on in the Department of DCFS, which I will work on, but there's still an unfairness, and that unfairness comes from each of us carrying our own biases and things of that nature. So if we would, you know, we can do healthcare, we can get jobs, we can do all these hot button topics, but when it comes down to it, the meat of it is the individuals that are pushing these things, that are allowing people to have jobs, that are allowing people to have access to education. So I just want to say that to say, let's focus on how that gets disseminated out is the individual that is actually in these positions that are sitting in front. Let's take DCFS for example. Most of the kids that are in the care are African American. I've went over this with Cindy Weiskettle, Director Weiskettle. Why is this? And she's given me her determination. Well, it all comes to equity. And we're spending millions and millions of dollars to add on all these kids that we must take care of, when if we would really focus and work on what Councilwoman Brown is pushing here, then those numbers would come down. So let's focus on not only the resources and the money that we throw at it, but the individuals that can change these people's lives. Thank you.
Thank you, Councilwoman Conwell. Do I have any additional comments from my colleagues? All right, with that pause, I'm going to take full advantage of this opportunity because I wanted to just touch on and how did we get here? And some of us might think that this was due to the recent incidents of the killings of unarmed Black people, or even the disproportionate effects of COVID-19 on Black people. However, these recent events only accelerated and amplified the need for the county to take much needed steps, which had already begun long before these unfortunate events occurred. I was prompted to introduce racism as a public health crisis after participating in first year's Cleveland Pregnancy and Infancy Loss Committee, where I had the privilege of working with Terry Allen as well. I have a tremendous amount of respect for him and the work that he does. And he, as he said, has been long committed to doing this work. It prompted me to present the idea to our council staff, only to discover we had the equity legislation already on the books. In fact, I must commend the county for the initial work that has begun around this matter. In 2012, council members Conwell, Miller, Brady, and Jones, along with former members Julian Rogers, Chuck Germetta, and my predecessor, C. Ellen Connolly, sponsored an ordinance in August of 2012, which was passed unanimously, I might say, and signed by the former county executive, Ed Fitzgerald. The premise was to, quote, commit an improved focus on equity for all our communities and citizens, and with a desire to demonstrate such a focus on equity in its internal operations. I think that's very important. That's what Councilwoman Conwell is focusing on. Focus on equity in its internal operations and in the manner which the county promotes the economic, educational, health, and social progress of the county and its residents. The legislation went on to say an implementation of a focus, and I emphasize well-defined approach to equity in Cuyahoga County is necessary for successful performance of the county's economic development role. As Councilwoman Stevens have pointed out, also, the economy is going to be essential. Working with partners across the county is going to be essential. We will not be able to address the issues today, all the issues of the racial inequities today, particularly in this committee. But I have to commend us because we were already on the right track. Therefore, knowing this, it was important to me that we build on the foundation that was laid to ensure that we could begin the long overdue work of matching our actions with our words. With that in mind, we put a timeline in before the end of the year. By declaring racism as a public crisis, as Terry and Ramona pointed out, or Mr. Allen and Ms. Brazil, we are acknowledging the problem exists along with our willingness to resolve it. I am grateful for the overwhelming support this resolution has received. And more than anything, I think it is important, and I look forward to developing the meaningful, impactful, and transformative legislation to eradicate the systemic, structural, and institutional barriers that have disproportionately disparate impact on Black people. So I couldn't be more excited. This is a big day in our county's history, because this for me was important to note that it's going to be more than words on paper. We have the commitment and buy-in from so many individuals, including my council colleagues. And I think it's also important to note, this is not a left or right issue, it's a right or wrong issue. And I'm very grateful for my colleague on the other side of the aisle, Councilman Gallagher, for joining in and supporting this legislation as well. So I want to thank all of my council colleagues for your sponsorship, Councilman Miller, Brady, Jones, Conwell, Tuma, Stevens. If I miss somebody, charge it to my head, not my heart. But I just want to thank you because this is critically important. So if there's no further questions, comments, or concerns, I think now is the time we can make a motion, and I'll make the motion to move this to the full body of the council under second reading suspension. Do I have a second?
Second.
All right.
We got a lot of seconds.
If there are no additional questions, comments, or concerns, all in favor, please say aye.
Aye.
Excellent. Thank you very much. Thank you all for your participation. Now we will move on to the next item on our agenda. Council Clerk, will you please call the roll? Thank you, Mr. Allen. Thank you, Ms. Brazil.
Resolution number 2020-0127, confirming the county executive's reappointment of various individuals to serve on the City of Cleveland, Cuyahoga County Workforce Development Board for the term 7/1/2020 to June 30th, 2023.
All right, Ms. Pomerantz, Director Pomerantz, you have the floor. If you'll give us a little bit of background, and
Sure thing.
the floor is yours.
Sure thing, Council Chair. The Workforce Development Board serves as the advisory body for the Cuyahoga County Department of Workforce Development. The purpose of the department is to provide resources and information that assists residents of Cuyahoga County in moving toward financial independence through employment. Its programs and services include education, job training, job search assistance, and employment-related youth programs that are funded through the Federal Workforce and Innovation and Opportunity Act of 2014. The WDB, by law, provides policy and guidelines and exercises oversight of the service delivery area, City of Cleveland and Cuyahoga County, in partnership between Cuyahoga County and the City of Cleveland. And on behalf of the county executive, we are pleased to nominate 3 people for reappointment. One is Camila Lee for a 3-year term, 7/1/2020 to 6/30/2023. This is a joint appointment with the City of Cleveland. Kim Shelnick for a 3-year term, 7/1/2020 to 6/30/2023. This is a county-only appointment. And Sheila Wright, a 3-year term, 7/1/2020 to 6/30/2023, and this is also a county-only appointment. I believe they are all here on the Zoom with us, as well as Ida Ford, who is representing the organization today and can speak to other questions as well.
Good morning. Thank you very much. Before we turn it over to our first candidate, Ms. Ali, I will ask my council colleagues on the committee, do you have any questions for Ms. Pomerantz with regards to the board? There being none, Ms. Ali, you have the floor if you'll give us a little bit of your background on why you would like to continue to serve.
Good morning. Well, good morning still.
Yeah.
Good morning. I am no problem. It was a very good information. I appreciate all of it. Thank you. I actually work for Opportunities for Ohioans with Disabilities. I supervise counselors as well as administrative staff, and we help individuals with disabilities to find employment. So the information about the equality and leveling the playing field, definitely familiar with those conversations and used to having those. Regarding the appointment for the board, I've served on the board for a few years, and I've served on other boards, and I will say that Cuyahoga County is very progressive and as well as takes the approach that is necessary. I've been on term with other administration, with several administration, and Cuyahoga County is very consistent. I will say that. And not consistent in the fact of being stagnant, but always pushing forward. I've appreciated many of the events that have results and are continuing to look for results in making better outcomes for the residents of Cuyahoga County, as well as other counties as well. And through our swag events and in-demand jobs week has been very great. And one of the things that I applaud the board on is continuing with relationships with employers and actually finding out what employers need and making sure that they're able to present qualified candidates to get individuals hired.
All right, thank you very much. I'm going to open it up to my colleagues. Does anyone from the committee have any questions? The one question that I'll present, Ms. Ali, is what are some of the challenges you identify?
Well, speaking from my specific situation, one of the challenges that I believe is definitely making sure that all areas, and not, obviously we talk about race and all of those things, but I would say regarding individuals with disabilities, making sure that we're all, that they receive access to all of the services that are available to them. And so we've actually talked about this on different occasions, and not just individuals with disabilities, but other aspects of this diversity, as well as to just try to help all of us know what our services are, so that we're not duplicating services, but making sure that people get to the right front door and get the services that they need.
Thank you very much. And I think it's very good that you point out the individuals with disabilities, because oftentimes when we think of diversity and inclusion, a lot of people just think about race, but that is a much broader category. So I appreciate you mentioning that. Are there any other questions, comments for Ms. Ali? Well, Ms. Ali, it looks like you have gotten off easy today. Clearly your work has been good, and we thank you for your willingness to continue to serve in this capacity. And we also sincerely thank you for your patience as it related to the presentation around our first resolution. So with that being said, I'm going to move on to our next candidate, which is Ms. Kim Shelnick. And I see you're here. So Ms. Shelnick, if you'll give us a brief background and why you'd like to continue to serve in this capacity, please.
Thank you.
Uh-oh, we're having a little difficulty hearing you.
Can you hear me now?
It's a little better.
Okay.
Yeah, okay.
Okay, good morning. I sincerely appreciate the council's time and this opportunity. As mentioned, I'm Kim Shelnick. I'm the Vice President, Talent Acquisition, Workforce Planning for University.
I'm sorry, Ms. Shelnick. It's still a little difficult to hear you. I'm not sure if it's
I'll be the next person and I'll call in, okay?
Okay, we can do that.
Okay, thank you.
Okay, I see Miss Sheila Wright. Miss Sheila Wright, we're going to move you up so Miss Sheldon can check her connection. And I hope you, again, I want to thank you for your patience during our previous legislation and welcome you to the HR committee. And if you will give us a little bit of your background and why you'd like to continue to serve.
Thank you, Chairwoman Brown, and thank you, Councilwoman Brown. And also, thank you to the entire council who's here. So I've had the privilege of serving on this committee or this board in the past, and it aligns to, I think, a lot of the work that I've done personally and professionally from a civic standpoint, policies, kind of a, if you will, a juxtaposition, if you will, around government, if you will. And so when I had the conversation with some of the folks on the board, Ida Ford, who has just been a ball of energy and fire for the board, about getting back involved and remaining on the board, I gave considerable thought to what's happening in our state, what's happening in our community. And I have I would say the privilege to be involved, privy to a lot of conversations about our economy here in Ohio, here in Northeast Ohio. And as I'm listening to conversations about what the plan is for the next round of our economy, when there are discussions about how do we jumpstart our economy, particularly post-COVID, but even prior to that. And then when you push that up against a backdrop of equity, I think about all the changes that are getting ready to happen in the world of workforce as it relates to economics. I anticipate seeing manufacturers and owners of companies whose primary focus is manufacturing move more to automated systems. When that happens, what you see is a rise in displaced workers. And the conversations and the energy and investment that I'm bird dogging, that's trending right now, is around knowledge economy jobs, healthcare jobs, science, technology jobs, which makes sense because we are considered one of the healthcare meccas. So it makes sense to leverage investment into where we have anchors. I guess my question is, and I think the work that I would like to bring or the value to this is, what are we also going to do to align that with our displaced workers? Because they don't automatically graduate to knowledge economy jobs. What are we going to do with them? Typically, in a market, and Councilwoman Brown, you know this, they typically go to service industries. But that's going to look different in COVID. So I think there's an opportunity I just see this as an opportunity to continue to serve in capacity in which I have served, but also bring this awareness, bring a voice to some of this and help with the structuring around this. I'm excited about the people that are involved in the workforce board. I'm excited about the new leadership and the commitment. And so I just, for me, it's just a natural space to continue the work that I do. I'd be honored to continue serving in that capacity. I can add some value to that, hopefully.
Well, I trust that you will. I have had the pleasure of witnessing your work in different venues. So I thank you for your willingness to continue to serve in this capacity. And with that said, I'll open it up to my colleagues if we have any questions specifically for Ms. Wright. And I see Councilman Miller. Councilman Miller, if you'll proceed, you have the floor.
So, Ms. Wright, it's very good to see you, and I commend you for your willingness to continue to serve. And my question is whether we've seen a substantial uptick in people seeking services in the COVID-19 environment, or are people basically waiting and hoping to go back to their old positions?
So are I'm sorry, can you clarify that a little bit, Councilman Miller? I'm sorry, I might not have heard you correctly. You're asking about the people who essentially have been off work in light of COVID?
Yes, I'm asking whether you're seeing an uptick in people seeking workforce services, thinking that they're not going to be able to go back to their old jobs, or are we not seeing that? People are mostly holding out, thinking that they're going to be able to go back to their old jobs.
Ms.
I
Wright,
can help out with that as well, if you
have a
wanted me to
lifeline.
chime in.
Yeah, so Ms. Wright, looks like you have a
Yes.
life. I'm not sure if you've met since the COVID-19, but I will turn it over to Ms. Ford. Ms. Ford, if you'd like to address that, it looks like you might have some insight.
Yes, thank you so much, Madam Chair. I appreciate the opportunity. But yeah, a couple weeks ago, we had the virtual job fair.
Before you continue, could you state your name for the record, please?
I'm sorry, it's Ida Ford. Why did I think I have to come closer? I don't know. It's Ida Ford. Last week, a couple weeks ago, we had our virtual job fair, and we did a lot of marketing and outreach to the community. And we had over 2,700 job seekers that participated in that event with over 83 employers and 333 plus job openings. And these were individuals, sir, that clearly know that their industry may be closing, and they're willing to pivot into a different opportunity. Looking at healthcare, we didn't have positions like contact tracers or wellness checkers. We've had an increase in the service industries and in logistics. And people are willing to look at some of their skill set that they may have had if they were a salon owner or something like that, and to kind of pivot those into different industry sectors that are in demand. And we have funding available for those individuals to do just that, especially during this time. If you're told, stay home primarily, then why not stay home and look at some of the training that we can offer online? And they're essentially, basically, because they're out of work, it could be free. So yeah, we've seen a lot of changing, and that mindset has been wonderful. As looking at maybe manufacturing and saying, I don't want to work in a manufacturing environment because maybe their perception from the old days is as dirty. But no, manufacturing is lean and it's clean. Manufacturing has an increase, and that means that there's an increase if they're making protective equipment. That means there's an increase on the warehouse floor, which means that there's an increase in human resource department, which means there's an increase in the quality assurance department, and so forth and so on. So yes, we've seen a lot. I hope that answers your question.
Well,
Yeah.
well,
So
yeah.
thank you for that, Ida.
You're welcome.
And I just want to say to Councilman Miller, thank you for the question. And Ida, thank you for that backdrop. What I will tell you, just in some of the work that I do, we have been following trends of, some of you may know, population, movement, markets, employment. We've been working on this for years in terms of policy and working with our local governments and our officials. And so I'm glad to know that people are taking advantage of the opportunities that's presented through the Workforce Board. But what I will say, and I'd like for you all to be cognizant of, is again, a reminder, what we have seen pre-COVID is that when workers are displaced, their typical go-to, if they don't have time to go for more training or to get more certification, they simply have to pay the bills. Their typical go-to is service industries. And those industries will look different post-COVID. We see a lot of people moving to the gig economy, DoorDash, Instacart. That is heavily saturated right now. And the manufacturing companies that Ida spoke about, those specific jobs that she talked about, quality assurance and HR, those are typically more skilled workers. But many of the owners
of these companies have spoken for years, and we all know this, for the need and the desire to automate. They've wanted to automate for years, but could not slow down production to automate. And it simply doesn't look good to have rows and rows of people coming off your books. And COVID has provided a very twisted gift because they've been able to slow down production and begin to implement full automation. And so as we are all doing this work, I would like for us to ask ourselves, where are these displaced workers going to go? And what is the time frame for those who don't have the opportunity to pivot quickly for those higher skilled jobs? So I'll take the rest of the questions quietly.
Go ahead, Councilman Miller.
So, Madam Chair, Ms. Wright, it sounds like that there's a whole lot more people thinking about pivoting from one field to another, but maybe using some of the same skill sets and maybe developing some new ones. Does that sound right?
Yeah, that's going to be necessary, and that's why I'm very happy with what I discussed. You know, the opportunity for them to connect that they created with employers to be able to use those skills in different industries, if you will. But we have to be mindful of this, and I think that the Workforce Board is in a great opportunity, as well as these advocates and officials on this call, as the conversation and investment and resources are going toward particular industries as a way to jumpstart Ohio. We have to make sure that we are also shedding a light on those displaced workers who may not be able to benefit from those particular investments, because the investments, to my understanding, are not some of the lower skill, lower barrier to entry positions in health, science, and technology.
So, Madam Chair, Ms. Wright, I think the Workforce Board in this environment is going to be more important than it's ever been. So I appreciate your willingness to continue to serve us and support your nomination. Thanks, Madam Chair.
Thank you, Councilman Miller. Are there any additional questions, comments, or concerns for Ms. Wright? If there are none, thank you so much, Ms. Wright, for sharing your insight and again, your willingness to continue to serve. It sounds like we have some heavy lifting to do as we shift our attention from the current crisis that we're in to ensuring that those who will be unfortunately displaced due to automation, figuring out ways to incorporate them back into our economy successfully. So I'll be relying heavily on you for that solution. You and Ms. Ford and Ms. Ali. And now Kim, if you would, I'm sorry, Kim, are you there? Have you joined
Hi.
us?
Yes, can you hear me?
Yes, we can hear you now and you sound good. Okay, Ms. Shelnick, so we're going to turn it over to you. If you'll give us a little bit of your background and let us know why you'd like to continue to serve in this capacity.
Thank you. I sincerely appreciate the council's time and this opportunity. As mentioned, I'm Kim Shelnick, and I'm the VP of Talent Acquisition and Workforce Planning for University Hospitals. I've been in the role for 13 years at UH, and prior, I worked in talent acquisition and recruitment for Progressive Insurance and KeyBank, so I have over 32 years in HR within our community. Also, I've been active within the Workforce Board since 2013. Within my experience, I clearly recognize the importance of being a champion of workforce programs to develop and promote talent for in-demand fields in the region. This includes fostering diverse groups to provide needed development and opportunity in our community. Also, my expertise in workforce development and recruitment assists with the alignment of Ohio Means jobs and the services that they provide. The qualities I possess to make a good candidate for the board include the ability to both utilize and collaborate with the development ecosystem to create programs that support the hiring and development of underrepresented residents in the community. For example, I developed Step Up to UH, which is a partnership with Towards Employment to provide needed job readiness training, coaching, and employment at university hospitals, and then pathway programs to move those residents up. To date, we've hired 450 residents into the Step Up program with an 88% retention rate, and also have implemented pathway coach programs to really provide the needed assistance for lower paid employees at UH to support promotional opportunities with really great outcomes. Also, I possess strong community leadership through the relationships with the funders group and the workforce board, where we're starting up the healthcare sector partnership. And I did speak to county council in the past regarding the importance of the healthcare sector partnership. And right now we have selected Tri-C to be our facilitator. And then also we're in the process of hiring an executive director. Lastly, I do have several years of, as I mentioned, talent acquisition experience, and am overseeing the strategic workforce plan for University Hospital, where we are hiring and promoting over 5,000 residents annually. So again, I sincerely appreciate your consideration.
Well, thank you for your willingness to serve in this capacity. You touched on the 88% success rate with the Step Up program at UH. Are those candidates primarily funneled through the workforce development, or how does that work?
Yeah, so how it works is we have worked with, of course, the workforce board, also Neighborhood Connections and other community agencies, and Towards Employment to go out into the community to really recruit individuals in the underrepresented neighborhoods in the greater University Circle area, and providing that needed assistance, wraparound services, job readiness training, to support those individuals in being employed. So literally what UH does, which is going above and beyond, is we hold positions for this program. And then in addition, we provide a year of additional coaching to ensure that we get that 88% retention rate, that we're providing those needed services to help those individuals retain employment and also move up. It has been an extremely successful workforce development program in our community.
Thank you very much, Ms. Shelnick. I'm going to open up the floor to any of my other council colleagues who may have questions. Councilman Miller? None? Okay. There being none, out of respect for time too, we are so grateful for you ladies that are willing to continue to serve in this capacity and taking the time out of your day to share your desire to continue to serve. So with that being said, I'm going to make the motion to move this to the full body of the council under second reading suspension. Do I have a second?
Second.
It's been seconded by Councilman Miller. If there are no additional questions, comments, or concerns, all in favor, please say aye.
Aye.
Aye. Thank you very, very much. All right, Council Clerk, if you read the next item into the record, please.
Resolution number 2020-0128, confirming the county executive's reappointment of Elsie Caraballo to serve on the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County for an unexpired term ending June 30th, 2023.
Thank you very much. I'm going to turn it over to Ms. Pomerantz so you can give us a little bit of background here.
Sure, Madam Chair. The Alcohol, Drug Addiction, Mental Health Services Board of Cuyahoga County is responsible for planning, funding, and monitoring of public mental health and alcohol and other drug addiction services that is delivered to the residents of Cuyahoga County. And I, on behalf of the executive, am pleased to ask for appointment for Elsie Caraballo for a 4-year term, 7/1/2019, ending 6/30/2023. Ms. Caraballo is here on Zoom, as well as Ms. Linda Lamp, who represents the Adams Board, to help support any questions that you or the council members may have.
Thank you very much. I'll open up the floor to my colleagues if you have any questions for the administration with regards to their appointments recommendations. If there are none, Ms. Elsie Caraballo, if you will please. I know you've been waiting so patiently. So now's the time. The floor is yours. If you'll give us a little bit of background and why you would like to continue to serve in this capacity, we would be so grateful.
Yeah, thank you, Council Chair, and all the council members. It was actually an eye-opening presentation, but I have been with the board for quite some time. I was appointed by County Executive Fitzgerald. I'm retired from the Job and Family Services as the Center Manager for Old Brooklyn. I have worked with Humana as a case manager and currently work with a company called Able2 as a behavioral coach, which is telehealth. So that's a very interesting and very rewarding job and keeping me connected to my background. A social worker background, graduated from Akron University. So I'd like to be reappointed to the board because it's a very important matter to me as far as keeping engaged with the community, especially with the work that they do. The board, it's a passion to me, and it's personal, which me with having family members and friends with addiction and with addiction issues, seeing them struggle and seeing them succeed or not succeed, but having those resources out there. And I have a brother who's actually been sober for over 40 years, 40 plus years. So the resources that the Adams Board provides and the funding and monitoring that is in place with our providers, it's an extreme example of the commitment that the Adams Board has. And also all the other trainings that they provide, such as the CIT training, the training website, which is available now online since with the COVID. And especially since the COVID, the board and the director, Scott, the CEO, has gone business as usual, even though it's been a challenging time for this time. But so I would appreciate continuing on the board to continue my expertise.
Thank you very much. I just want to jump back. You mentioned CIT. Just for the public, what does the CIT stand for?
It's community. I'm bad at it. It's community.
Ms. Ford, do you have us that? Is that something you can help us with?
That would be Ms. Lamp from the Adams Board.
Okay, I'm sorry, Ms. Lamp. My apologies, Ms. Ford. I just made you the go-to person for everything.
That's okay.
Thank you, Madam Chair. CIT stands for Crisis Intervention Team Training, in which that's being done through our Education and Training Department at the Adams Board. And I know that Mr. Osicki works hand in hand. He is a co-chair of the Mental Health Response Advisory Committee.
Thank you very much. And there's a reason I just wanted to put a pin in that is because as we begin to transition and conversations are developing around police reform and services, I think it's important that we highlight that the county and the Adams Board are already taking steps to utilize crisis intervention training to use de-escalation tactics, especially as it relates to individuals that have issues around mental health. And so I just want to commend you guys for doing that work. So I thought that was it, but I wanted to be sure. So I appreciate you, Ms. Lamp, and I appreciate you, Ms. Caraballo, for highlighting that. If there are no additional questions, comments, or concerns, out of respect for time, I know you guys have been hanging in there patiently with me today, and this is not par for the course for Chantel Brown. Anyone who knows and have attended my meetings know that efficiency and time management is one of the skills I take pride in. So if questions, comments, or concerns, I will move this to the full body of the council under second reading suspension. Do I have a second?
Second.
All right, it's been seconded by, I'm going to throw that one to Councilman Jones. If there are no further questions, all in favor, please say aye. Aye. All right, no opposed. This will move to the full body of the council. And finally, Council Clerk, if you'll read the last item into the record.
Resolution number 2020-0129, confirming the county executive's reappointment of Beth Sipple to serve on the Cuyahoga County Advisory Board on Senior and Adult Services for the term 1/1/2020 to December 31st, 2020.
And Ms. Pomerantz, we're kicking it back to you. So if you'll give us a little bit of background, please.
Great, thank you, Madam Chair. The Cuyahoga County Advisory Board on Senior and Adult Services provides a forum for seniors, adults, and adults with disabilities, consumers, elected officials, agency representatives, and others interested in concern of seniors and adults. And we are pleased to nominate for reappointment to this board Beth Sipple for a 3-year term, January 1, 2020, expiring 12/31/2022. I know that Ms. Sipple is here on our Zoom with us, as well as Maridal from the DSAS department. And I believe Director Tracy Mason may be as well to help support any questions that you or the board may have.
Colleagues, do you have any questions? Committee members, do you have any questions for the administration? I don't see any. All right. Or Councilman Jones, do you have a question?
No, I don't.
Okay. All right. With that, I'm going to turn it over to our marathon award winner, Ms. Beth Sipple, for sticking it out to the end with us today. If you'll give us a little bit of background and tell us why you like to continue to serve in this capacity, please.
Well, thank you very much to the council for allowing me this opportunity to speak. And my name is Beth Sipple, and I'm Director of Community Services and Programs for the Benjamin Rose Institute on Aging. I've been serving in Cuyahoga County with the older adult population, specifically in Cleveland, for 30 years now. And I have a strong commitment to the seniors, their caregivers, older adults in Cleveland and Cuyahoga County. I think it's very valuable for the committee, the advisory committee, to have representation from community-based services and organizations. And I oversee adult day programming, behavioral health services, social work services of all folks who are working right with older adults in the community. And we have firsthand knowledge to a lot of the issues that these folks are facing. I would like the opportunity to continue to advise the board by providing input into the procedures, issues, and protocols of the work performed by the Department of Senior and Adult Services. And I value the work that they do. And I've been serving for about a year, and I also serve on the subcommittee of community-based programming. I'd like the opportunity to continue to do so.
All right, excellent. Thank you for your willingness and dedication to continue to serve in this capacity. I am going to open it up to the committee members to see if they might have any questions. I think I've worn everybody out today, Ms. Sipple. So with that said, I just want to thank everyone for hanging in there. Thank you again for sticking with us in not only just this meeting, but again, the work that you're doing is greatly appreciated. So if there are no additional questions, comments, or concerns, then I will move this nomination to the full body of the council under second reading suspension. Do I have a second?
Second. This is
It's been seconded by Councilman Miller. If there are no further questions, all in favor, please say aye. Aye.
Aye.
All right, thank you very much. We're a little over our time. This has to be a record for the Human Resource Appointment and Equity Committee meeting. We've never gone this long before, but we covered very important legislation, and could not do this work without the support of our staff. I want to give a big shout out to T-Mac, Trevor McAleer, for all the work he did and the research he did relative to the council legislation for the racism as a public health crisis. I want to thank the team that is the Cuyahoga County Administration and Council for being a collaborative unit as we work to continue to make Cuyahoga County a greater place for everyone to live. So thank you all. If there's no miscellaneous business, I appreciate you hanging in there with me. Any miscellaneous business? Going once, going twice. All right, Gallagher, the show is up for you next in less than an hour. Everybody else have a wonderful, wonderful day. Thanks again. Bye. This meeting's adjourned.